welcome to today's discussion on the next steps for vaccinating Minnesota's workforce against COVID-19. I'm your host, Bobby Patrick, and I'm the Vice President of Strategic Growth and Policy for the Medical Alley Association. Today, I'm very fortunate to be joined by Joanna Dornfeld, the Director of the COVID-19 response for the Minnesota Department of Health. Joanna, thank you for being with us today. Joanna will be providing more information and detail on what the next steps will look like for critical workforce sectors with a focus on manufacturing. After her initial presentation, we will move to your questions. So be sure to submit any that you have for Joanna via the Q&A function on your screen. Please note that if you're able to stump Joanna, she will take the question back to her team and we will get you an answer as soon as possible. So if you're the one that asked that question, please email me if that is the case. Before we get to Joanna, one quick note. Note that this event is being recorded and will be available on Medical Alley's website, medicalalley.org, later today under the Events tab. It will also be available on our recently launched COVID-19 vaccine resources for employers and employees page, which you can access via the Medical Alley homepage by clicking on the link at the top left of your screen. The resource page will be updated regularly with new information throughout the coming weeks and already has a great set of information, including the employer toolkit from the Minnesota Department of Health. Again, please remember to submit any questions you have for Joanna via the Q&A function on your screen. And with that, Joanna, again, welcome. Thank you for being here, and I will turn it over to you.
Thanks so much, Bobby. It's a pleasure to be here with you today and with all of your members. I'm going to go ahead and share my screen and walk through a few slides with all of you to kind of give you a status update for where we are in our COVID-19 response. And I hope to answer many of the questions that you might have, given that we have moved on to expanded eligibility here in Minnesota. First, just want to kind of ground you with where we are. These numbers, my apologies, are a day old, but as of yesterday, Minnesota has provided 1.9 million cumulative doses of the COVID-19 vaccine across our state. That is about 23% of our overall population. We're very excited about the progress that we have made over the last number of weeks. This also means that we have more than 700,000 Minnesotans who have their completed series, which is about 13% of our population. And as I think many of you know, we really focused our vaccine on vaccinating for impact. And so our priority populations initially were those most at risk of being infected with COVID and those most at risk of serious illness or death. And so we have made significant progress, and you see that in our daily hospitalization numbers, as well as the daily death rates that have really dramatically declined over the last couple of months. Something we're very proud of, but we know that we're not done yet. We have a lot of work left to do. We hope to do in partnership with you to ensure we can get to that safe community status. A couple of other notes for you. We are administering about 40,000 doses per day. Some days a little bit higher than that, which is a fantastic rate and wouldn't be possible without the important partnership with our many vaccine providers across the state. Those include healthcare providers, pharmacy, local public health, as well as the state vaccination sites. And lastly, just flagging for folks that, as of yesterday, we ranked 5th in the percent of doses administered across our entire country. Minnesota continues to really prioritize getting a vaccine into the arms of Minnesotans as quickly as possible so that we can ensure that we are providing the community safety and herd immunity that we know is going to be so critically important to be able to move on and move through this pandemic. So just last week, Governor Walz and Commissioner Malcolm announced that we had surpassed our goal that we would vaccinate 70% of our 65 plus population. So we expanded eligibility to some additional groups. The first tier that we are rapidly vaccinating at this point, we have heard from our provider community that those individuals with these very specific underlying conditions that make them most at risk, that we've successfully vaccinated this population already just over the course of last week. We are also actively vaccinating our food processing plant workers and those with rare conditions or disabilities that put them at higher risk. In addition, the governor and Commissioner Malcolm also opened up eligibility to a much larger group of population in the state of Minnesota. Those that are between the ages of 44 and 65 with one underlying medical condition, those in a number of our essential frontline essential worker categories, most importantly for this call, manufacturing, and then those that are age 50 plus in multi-generational housing. And we are very quickly moving into vaccinating this tier of Minnesotans beginning last weekend. More specifically, manufacturing is, as you know, a broad and diverse category. And so there's a number of different types of manufacturing that are eligible, including those that manufacture medical device. It's not just those folks that are your actual manufacturing employees on the plant floor, maybe constructing or putting things together, but those that are working in the manufacturing facility, whether those be janitorial staff or other folks that are intermixing with kind of all of your other workers that are kind of working on the front lines every day. I'm happy to answer more specific questions about who within your facilities are eligible, but want to make sure that it's clear that it's those that are kind of on those front lines, working on those plant floors, regardless of the task that's in front of them. Just a quick reminder about kind of where we are. All of the populations that are in the yellow or orange color on the left are those that are currently eligible. Those individuals that were previously eligible before the announcement last week continue to be eligible, and all of our provider partners, including the state, continue to vaccinate them. And then we did move in to expand, as I just kind of walked through those in that March, April timeframe as well. And so we do have a little additional work to go once we get these folks vaccinated, but are very excited about the progress that we're making in Minnesota. We certainly were able to open up eligibility even sooner than we had originally predicted, and anticipate that we will be able to vaccinate this currently eligible population of about 1.8 million people, even more quickly than we had thought, given the increased vaccine doses that we're seeing coming to Minnesota. So as importantly as who is eligible is how you can help, how we can partner from the Department of Health with all of you to provide vaccination opportunities for your employees. The two primary ways that you as an employer can help and partner with the Department of Health is to first host an on-site vaccination clinic, if that makes sense for you and for your employees. Secondly, you can, if it does not make sense to host an on-site vaccination clinic, connect your employees with appointments through local public health, pharmacies, and state-run mass vaccination sites. On-site vaccination specifically, the Department of Health at the end of last week launched, as Bobby mentioned, an employer toolkit. One of the important features of that toolkit is a portal where the Department of Health is seeking to collect information from you so that we can help navigate and allocate doses for you to host an on-site vaccination clinic. Some of the important information that we will want and need to know are the number of facilities. We know many of you have multiple facilities, so it may be that you would need to host multiple events at various facilities. The number of employees, both total employees, but also by facilities, so we can work through the logistics of an on-site event, and also who your vaccine provider might be. That could be your existing healthcare provider. Perhaps you have an existing provider that you operate food clinics in the fall. That would be a great starting point. It could also be a local pharmacy. We have many of our pharmacy chains across the state of Minnesota that have been doing on-site vaccinations, primarily targeted our long-term care initially, but we are largely through that population. And so certainly have capacity to partner with industry to host on-site vaccination clinics. And then lastly, local public health. We found even just in our first week with opening up vaccination for food processing facilities across the state, many of them are choosing to partner with their local public health agency who are able to come in and provide on-site vaccination. And all of these are viable options, and it will just be a matter of kind of working through what makes the most sense for you and for your employees. The last thing that will be an important consideration and something that the Department of Health is happy to kind of walk through and talk through with you is just the site constraints or facilities that you might have to offer on-site vaccination. It's not only important to have a safe space where people can be socially distanced to administer the vaccine, there also needs to be enough space for individuals to wait and rest for 15 minutes after they receive their vaccine, just in the event of any allergic reaction. And so wanting to be able to kind of walk through and make sure that the facility that you choose will be able to provide kind of for all of those needs moving forward. But again, conversations with the Department of Health and your provider partner are more than happy to have to work through those logistics. For those that it does not make sense to host an on-site vaccination, and that will be true for a number of companies and organizations for any number of reasons, we would really appreciate your partnership and support to help inform your employees about where they can go to get vaccinated. One of the key tools that the state has provided is the Vaccine Connector. It's a place where any individual can go at any point in time to sign up and indicate they are ready and interested in being vaccinated. The state is using this tool to communicate with folks about when they're eligible to be vaccinated, information about vaccine opportunities in their area, and also to schedule specific vaccine appointments at our state sites. However, you don't have to wait for an invitation to be vaccinated at a state site. If you are currently eligible, you can call your provider, you can go to a local public health clinic, you can go to your local pharmacy. Any and all of those are viable options for individuals. And again, it's based on what is going to be best serve the needs of your employee and employer. Lastly, ways that you can help and continue to partner is to really communicate with your employees. We know how critically important it is for people to receive information from a trusted source of information. And so your ability to raise awareness about the vaccine, address common questions and concerns, and to build a bench of trusted messengers within your workforce is going to be incredibly important so that employees who maybe have questions about the vaccine or are unsure are able to obtain the information they need to make an informed decision about whether or not they want to be vaccinated. Much of this information and tools that would be valuable for you to communicate with your employees, you can find on the Department of Health's Employee Toolkit. It has information, some of which I've gone through today, but really in greater detail about how to vaccinate your workforce, just information about the vaccine in general to answer some of those key questions. It includes links to the CDC's Essential Workers COVID-19 Vaccine Toolkit, information about how to connect with the Department of Health, wanting to make sure that we are able to answer questions and provide support to you along the way, and also some legal guidance. We do intend and hope, as we've collected questions over the course of the last week or so, that we'll be also adding a frequently asked questions page to that site. Stay tuned. We hope that will be live next week. But in the meantime, please don't hesitate to reach out to the Department of Health with specific questions so that we can continue to answer them and support your efforts to vaccinate your workforce. With that, I will pause. I know I went through a lot of information in fairly short order, but really happy to answer your questions so we can continue to work together to ensure your employees have access and opportunity for vaccine.
Great, thank you, Joanna. Really good information here, and so questions are starting to come in. So maybe I'll just start with this one. So would the manufacturing of pharmaceuticals or biotechnology also fall under the manufacturing eligibility? And then there's a follow-up question, but I'll let you answer that one first.
That is a good question, and I believe the answer is yes. I'll leave it there. I believe the answer is yes.
Okay. All right, great. And then additionally, could you clarify under the healthcare or essential workers if clinical research staff that have to visit healthcare facilities would also fit into a priority or essential worker category?
Currently, the frontline medical health workers are those that are really patient facing. So those that are kind of in more of that clinical or research space are not currently eligible. However, we are, as I mentioned, really vaccinating at a much faster rate than we had even anticipated 2 weeks ago when the governor first laid out this glide path. And we are very optimistic that we're going to be able to provide additional eligibility opportunities for folks here in the coming weeks.
Okay, great. Thank you. Next question. Regarding on-site vaccinations, would an on-site event be only for the employees, or does it need to be open to the public as well?
An on-site vaccination clinic would be, at least at this point, intended for employees only. We have had some questions about being able to expand eligibility to include families and others. But at this point in time, given the current eligible populations, those vaccine clinics are restricted to employees.
With the vaccine connector, one of the questions asks if you can go get a vaccine on short notice. Are there opportunities to get a vaccine sooner than your eligibility group if places have extra doses and would like to fill those slots?
The state and our guidance to our provider partners is if you have extra doses at the end of the day to really continue to mine the list of currently eligible people to ensure that they are having first opportunity and option for a vaccine. The way the glide path was put together is really to continue to vaccinate for impact and to vaccinate those in highest risk settings, and also those that are most at risk of severe illness and death. And so really trying to kind of, well, we're still in kind of the early, maybe the first half of our vaccine distribution, making sure that we continue to prioritize those that are most at risk.
Very good. A couple of questions sort of on the same lines. What sort of documentation is going to be required from workers to show that they're eligible to receive the vaccines?
Workers and employees, if it's an on-site vaccination, we don't anticipate any verification will be required because of it'll be kind of a closed pod and the vaccination will be happening there. For those employees who are seeking a vaccination outside of an on-site setting, encouraging them to bring, whether that be a pay stub, a badge, or a letter from their employer, just to verify that they are a member of an eligible workforce. However, we are, seeking to make vaccine opportunities as low barrier as possible because we know how critically important it is for folks to be vaccinated.
Okay. So unlike some other states where they're requiring a letter from your employer, that isn't necessarily required here, but it is an option for the employer to pursue if they would like.
Correct.
Very good. Can you clarify who is eligible for a vaccine within a manufacturing facility? Is it everybody, for example, office workers, or just the direct labor force and those interacting with the direct laborers?
As I said, we're continuing to vaccinate for impact. And so wanting to vaccinate those who are most at risk. And so really looking to prioritize those within manufacturing facilities that are working in those areas that are very close quarters where it's more difficult to socially distance. Those employees that can, continue to work from home or, otherwise, really encouraging those folks to wait. For example, I'm an employee at the Department of Health, and we have some of my colleagues who are in the public health and more public-facing positions. They are currently eligible for vaccine. I myself, you can see I'm sitting at my house. I'm not currently eligible for vaccine because I have the ability to kind of wait and not be in an at-risk setting, here in these coming weeks. However, we remain very excited and optimistic about kind of the speed at which we're vaccinating folks. President Biden put a marker out there just the end of last week to be eligible, that their entire population should be eligible by May 1st, which Minnesota is absolutely on track to hit. And so we're very excited about the interest in being vaccinated, and hope those that can wait do wait to allow those most at risk to have the opportunity here in the next couple of weeks.
Very good. Another question here. So I completed the form indicating that we are interested in offering an on-site vaccination event. What should be expected in terms of the timeline to hear back regarding the allocation of vaccines so that the event can be planned?
That's an excellent question. Our toolkit went live late on Friday, and the department did a lot of work over the weekend to push it out to partners. And I think our partners then pushed it out to all of their members early this week, which we're very grateful for. And so we have, I would say as of this morning, and it's Wednesday morning, we have 160 employers that have signed up so far. And so we are starting to work through that list. Our first priority, because they are tiered slightly higher, is that food processing sector, and we are making great progress. We had on-site vaccination for some employers in that sector even last week, and continue to work through. But you should anticipate hearing from the department over the course of the next week as we work through that list and that we anticipate will grow, to then we can build out a schedule to understand when you will be ready and prepared for a vaccine, and then how we can best allocate doses to you.
Great. And sort of a follow-up question on that, Joanna, for companies that are interested in having an on-site clinic and don't have a provider partner in place, what are some, how can they best reach out to providers to partner on having an on-site clinic? Are there resources on the Department of Health website, or how do you suggest going about that?
The Department of Health can certainly help be a match, or help, kind of match make for you. But encourage you first to, if your company offers, whatever offers benefits, to reach out to kind of whoever those benefit connections are, because many of them are already thinking about or offering on-site vaccination. Depending on where you are in the state, we've really heard it, particularly in greater Minnesota, outside of the kind of the 7-county metro area, that local public health is a preferred provider. And so encourage you to reach out to your local public health agency. And then, as I said, we're seeing particularly our chain pharmacy partners very interested in doing on-site vaccination. Some of those that you've been seeing in the news that kind of are receiving their own dedicated federal allocation. Some of them are using that federal allocation to do on-site vaccination, but the state is also able and more than willing to allocate some of our doses for those on-site vaccination as well. So we know some of those federal partners include Hy-Vee, CVS, Walgreens, Costco is coming on board just this week, Thrifty White Pharmacies. And so depending on kind of who is closest in your area, would just reach out directly to those pharmacies to identify if a partnership opportunity is available.
Great. And certainly, members are welcome to reach out to us as well, and we can help direct them or provide context too. So I'll just add on to that answer from Joanna there. Another question: how many employees does an employer need to have in order to have it make sense to conduct an on-site vaccine clinic?
Certainly. Particularly, I would say in the manufacturing sector, that that you have a wide range of employee size companies, or some very large, some more medium sized, and then quite a few that are smaller. I would say kind of our minimum threshold is about 100 employees, just in terms of size and scale. That's going to be something that's going to make sense. Some things that we're exploring with some companies are, if you and 2 or 3 of your neighboring companies, maybe individually don't hit that threshold, but does it make sense to partner together to host a vaccination event for all of your employees, as an example? And that is something that we're certainly exploring with some companies in certain parts of the state. Again, that's a great opportunity to partner with local public health. They could certainly offer, either it could be on site at one of your facilities, or at some place that's very convenient in the community that you can, cycle your employees through over the course of a day or 2.
Very good. Sort of following up on your answer about eligibility earlier, what about workers that are engaged in over-the-counter products for treatment of COVID with partners like Target or other pharmacies?
I would love for a little bit more information about what specifically that role is, and could be happy to follow up and provide more information, but I think it would kind of depend on specifically what the job is.
Okay, great. Well, we will seek that out and see if we can get that to you. So appreciate that. Another question: delivery drivers were considered essential workers during the stay-at-home orders, but they are not falling into these categories currently eligible for vaccination. Will that change, or will they just be part of the general public group? And I think I'll expand that a little bit, Joanna, because one question I wanted to ask you was, what do you see as far as how the timeline for this rolling out, and under, how things are going, what do you think the next workforce set will kind of come online for this?
Mm-hmm. So I can say specifically to the question about delivery drivers, they fall in kind of our transportation and logistics category, which is the next tier of workforce sector. And so those folks that work kind of in the transportation and logistics fall in that tier. They certainly are and have been and continue to be essential workers. But again, some of the workforce tiering was based on kind of the highest risk workforce settings. And so those that are kind of working in close proximity to colleagues, every single day, slightly higher risk than maybe, those that are doing some of the delivery. But we are looking forward to kind of moving very quickly. I would say, I hate to put a date or a marker out there. We originally thought it would take, a couple of months to get through this 1.8 million person population that is currently eligible, but we think it will probably be a matter of weeks, not months at this point, that we'll be able to get through a significant number of the population where it will make sense to then open eligibility to additional people. And again, Minnesota is absolutely on track to open up to our entire population by May 1st, as the president outlined last week. And so, we're just May 1st is just, 6-7 weeks away. We're moving very quickly, and we're very excited about the progress we continue to make.
Yeah, that things certainly seem to be moving along much faster than anticipated, even when the governor first made this announcement. So that's excellent news. I've received a couple of questions just clarifying the requirements for employees. So I'm just going to ask a follow-up here. So to clarify, an eligible manufacturing employee does not need any verification of get a vaccine. They only need to indicate to the vaccine entity that they are a frontline manufacturing worker. And I'll just take a step back. And so I think there's a distinguishing between on-site vaccination clinics and then if you're going to go out and get one from a provider in the public. So maybe you can just reiterate that to sort of help provide clarity there.
Absolutely. We do, for those that are offering or employees that are receiving on-site vaccination, there would be no eligibility or there would be no documentation required. For those that are seeking vaccination off-site, those that may be going to a local pharmacy, going to a state vaccination site, going to their local provider, they may be asked to provide a copy of a pay stub, a badge, or a letter from employer to verify that they are part of the currently eligible population.
Great, and sort of along the lines of from letters from the employers, we have some that have that already, and we're happy to help our members with that. But is the Department of Health going to be having a sort of template letter for that sort of thing eventually as part of the employer toolkit, or are you sort of relying on the trade associations and other groups to help the members with that?
We have linked on our site, the CDC actually has a template letter. So we've linked to our site to that CDC letter. I will say it does not mean we're not looking for something that's incredibly extensive, really something that's pretty basic and straightforward that just kind of identifies, the company and the sector, and, the employee. And I think that's pretty much it. It does not need to be kind of an extensive description of the work or why they are essential.
Yeah, and I think that just reiterates what the state and the Department of Health are trying to do is make the barrier as low as possible so that eligible people can get vaccinated and keep things moving along. So if folks out there have continued questions on that, please reach out to me and I can help answer a lot of those. And if there's anything that I don't know, I can get clarity from Joanna or the Department of Health. So the last question I have right now in the Q&A, and then I have a couple of my own that I just wanted to ask about. So, and this maybe is one where it's maybe a little more complicated to answer, but can employers require their manufacturing employees to get vaccinated?
Certainly not the first time that we have received that question. The blessing and the curse is I'm not a lawyer, so I'm not qualified to answer that question. And the Department of Health is also not really in a position to answer that question. We do know the EEOC has provided some guidance that also is linked on the Employer Toolkit site, but would really encourage you and your teams to consult your own attorneys about kind of what makes sense and is appropriate for your workforce.
So another question just regarding the sort of the 1A criteria, which we're sort of moving away from, but a question is, I think this touches on one of your earlier comments as it relates to patient facing. So the assumption is, at least from this question asker, that personnel working for a med tech company providing medical devices to hospitals do not meet the 1A criteria for an essential frontline worker. And I'm maybe going to just lead you in an answer here a little bit. I think some of that depends on what that person's role is within the hospital, but I'll defer to you on if you have further thoughts on that.
I think that would likely be true. I mean, it really is those frontline 1A essential healthcare workers was really designed to target those healthcare workers that are interacting with patients kind of on a very regular basis, daily basis, or, very regular basis. That was the intention, because we know how, as we saw cases surge in the fall, wanting to make sure that our healthcare workforce, if we faced another surge, was prepared to be able to handle kind of those influx of patients. And so that's, why they received that very early prioritization. And that's kind of what the criteria is based on. Those individuals that, that are patient facing and in those healthcare professions continue to be eligible. And we are still honestly vaccinating a few of them. Once you're eligible, you continue to be eligible. But really kind of focused on those that are, really frontline patient facing is the highest priority in that healthcare worker space.
So yeah, so I think I'll add to that, and then perhaps the person asking this question can just email me and we can chat offline. But from our discussions earlier and our understanding of the guidance, medical device folks that were working with physicians and working in patient settings were eligible under 1A, and then from there it was sort of how the provider interpreted what the work of that med tech worker was. So I think it's a little bit nuanced, as you indicated. And so, I'm certainly happy to have that discussion with anyone on the call who wants to talk about that further, as we've been engaged in that for 2-3 months now. So happy to have that. So thanks for your answer there, Joanna. So, and
I would add in that I would encourage folks who are working in those clinical settings to have conversations with the provider with whom that they are working. That is the best way to kind of address some of those, which can be a little bit more gray areas. The challenge of this is that there are not very many hard lines, and so trying to kind of work through. But again, being thoughtful about kind of continuing to vaccinate those most at risk.
Right. Yeah, very much. So I have a question sort of following up on the on-site vaccination piece. So there are going to be some employers that don't meet the employee threshold. I mean, not that it's a hard threshold, but sort of your guidance. And they're talking to the provider, say at an offsite pharmacy, about having sort of an organized event for their employees offsite. What are your suggestions, or what is MDH recommending for logistics around that? Or is there any guidance available for companies that are sort of pursuing that path?
I think it's really to, partner with that provider and to kind of determine what's going to work best for your employees. Like we certainly, again, food processing is a place that we have the most experience right now. There are some employers where just on-site vaccination doesn't make sense, but they're providing transportation for their employees to get to a site that's nearby, that's going to, best meet kind of the needs of both the employees and the provider and the employer. And so I think it's just really kind of working through some of those logistics with that provider partner. Again, the state of Minnesota is happy to kind of be a partner and kind of help facilitate some of those conversations. But my experience is that our provider partners really want to kind of figure out what's going to work best for employers and employees, and can kind of work through some of those challenges.
Yeah, I think the partnership is the key there, and really working together to figure out the best way to get your employees vaccinated. And it is possible the provider may have a different suggestion than you originally intended, and just to pursue that. So just to follow up on that again, your suggestion or your sort of threshold from MDH on the number of employees for an on-site was around 100, but a lot of it too, even at that point, is space related, and how can you accommodate the people that to rest after the vaccination is given.
Yeah, those are kind of the two kind of key factors, and just kind of thinking, really it's about talking to your employees and talking to your provider partner, because one of the other aspects is, do you have a sense about what percentage of your employees want to be vaccinated too, and to kind of think through. We know a number of employers have been doing kind of surveys of their employees to kind of be able to gauge even that metric. It's because we know that not all cases, there might be some folks that are kind of more hesitant and wanting to wait a little bit. And so just kind of having really open lines of communication and being able to answer questions, and then really working closely with that provider partner to kind of work through the logistics. Like I said, all of the provider partners that we have talked to have been really willing to be accommodating, kind of figure things out, including being accommodating for shift work. Making sure that they can offer vaccine at times that are even going to work well for your workforce. And so it is just kind of you're going to know best, working with your employees, kind of what is going to make the most sense, and being able to kind of work through those logistics. Would also encourage, if you have employee resource groups, if your workforce is unionized, working through some of those, kind of employee facing partners, again, has been a really successful strategy for us in the food processing sector, to be able to kind of know and understand what those questions and concerns might be, so we can address them on the front end to make the vaccination events, much more successful.
Very good. Yeah, very good. So a question is sort of clarifying the role of the vaccine connector for individuals. So after signing up on the vaccine connector, the person who does that, will they still have to proactively schedule their own appointment, or will they be reached out to regarding opportunities within their region to register for the vaccine?
I would say it's a both and. Once you're signed up for the connector, the state will reach out to you when you become eligible and will share information about vaccine opportunities. It is also the tool that we are using to schedule appointments. So for individuals once they become eligible. So, say I'm eligible this weekend, I could get an email from either Vault or Primary Bio, which are the two companies that the state has contracted with to actually provide our on-site vaccination, to then go through the process to, click and actually schedule my vaccine appointment. So the connector is being used kind of in that very integrated way for individuals. However, we're also using it as an example, Costco is coming online this weekend, and they are going to be another federal pharmacy partner, which is fantastic, given kind of where they have locations all across the state. So we are also then pushing information out to, again, those that are currently eligible, and trying to be as targeted geographically as we possibly can to say Costco is a new vaccinator partner. If you go to this website, click here, you might be able to sign up and find an appointment. And so it's a both and.
Great. And then for eligibility for on-site or through employer provided off-site vaccine clinics, it isn't required that an employee is signed up through the vaccine connector, but it is helpful for them to potentially be able to get a vaccine quicker than they would be able to based on what the schedule of the employer's vaccine clinic is. Is that right?
That is correct. That is correct. And I would also offer that you don't have to sign up for the connector to seek appointments at pharmacies or through your local provider. The pharmacies themselves are, posting their appointments as they become available, and you could. Another option, if that is what is best and most comfortable for your employees, is just to pull up the Thrifty White site and look for appointments, and schedule your appointment and show up.
Yeah, Thrifty White has been really good about that through this whole process. So for another question, so for Minnesota companies with remote non-Minnesota workers, so out of state. How should companies consider them within a vaccination prioritization if the remote worker fits the essential working category?
And I think it really depends on kind of the logistics around kind of what that remote work looks like. If they fall in the essential worker category, I'm trying to think of what that would look like, but the vaccine is a federal resource. Minnesota is not putting constraints about where you live or work to receive the vaccine. So I will say we are prioritizing individuals who either live or work in Minnesota to receive the vaccine. But we do know that, the goal really is not just in the state of Minnesota, but across our entire country, that we get to vaccination levels that we can all be safe. And so really, again, trying to prioritize our vaccines for those most at risk currently, but certainly want to be, Minnesota is going to continue to be a partner with all of our, colleagues across the country to ensure that we can get everyone vaccinated as they need to be.
Great. So I'm going to ask you one last question I have here. That's the end of the ones we have, at least for now. And while you're answering this one, perhaps any more will come in. Otherwise, we'll wrap up. So what is the best way for employers to get additional information or ask questions of the Department of Health as this process moves forward?
I think the number one place is to please check out our employer toolkit. I'm going to try and put it in the chat while we do it. But at the same time, so please first check out the employer toolkit and see if your questions are answered there. As I mentioned, we are going to be moving to add a frequently asked questions page here, we hope by next week. I have all of my regular tabs open.
Yeah, and it's available on our website. We can send that out to everyone who's on this as well as a follow-up. So
that sounds great. So that would be the first thing, but also on that site, there is a link or an email address for you to just email the department directly with questions that you might have. And then we can go ahead and follow up with you to answer any questions, and really, want it to be kind of a partnership and an iterative process. I'm also, in regular communication with Bobby as well to make sure as he's kind of gathering information or gathering questions from all of you. I mean, he will also continue to be a good source of information. again, the state can't do it alone. We need to do it in partnership with you. We need to do it in partnership with Medical Alley and kind of some of your other trade associations and partners. And so we're looking to keep the lines of communication open as much as we can and to work through any challenges that we might face in the coming days and weeks, but know that we're all in it together to get folks vaccinated here as quickly as possible. And, I'm really, my eye is really on the prize that May 1st goal to have our entire population in the state of Minnesota eligible, but then, really hopeful that Minnesotans will, do what is right, not only for themselves and their own health, but for our community to be vaccinated, and that we can be, returning to whatever our new normal is going to look like once we get towards kind of that middle of the summer.
Yeah, and I think, we were discussing earlier, it's, the partnerships and the communication that's being established now is going to be really important as we continue to move forward, because even once we get through this first set of vaccines and get the population through the first time, it's going to be a continued process and figuring out what's going to work best and moving forward. So we really appreciate the partnership with you and with MDH and with Governor Walz's administration. So we're looking forward to continuing to work with you. One last question before we wrap up. Can you repeat the names of the pharmacies and providers that the state has a partnership with or that they could reach out to for on-site vaccination clinics?
Absolutely. So from a provider perspective, I'm not going to be able to provide you a list because it would be the provider in your community. We're familiar with kind of the big ones that are, in the metro and across the state of Minnesota, but it could be your local hospital, depending on kind of where you are in the state. So really it would, look to your local provider partners and potentially those, that are you partner with to provide benefits to your employees. In terms of kind of the federal pharmacy program, the big chains that are currently receiving doses, those include Hy-Vee, CVS, Costco, Thrifty White. I should know these off the top of my list, but I keep adding one or two every single week.
Walgreens, I think, right?
Walgreens, yes, thank you. So I would say almost all of the major chains are interested. I will also say, I know I've had conversations with Cub Foods and Coburn's as well. They have on-site pharmacies in theirs, in their locations, and they are receiving, some of them are receiving doses from the state of Minnesota for state allocation, but not yet part of the federal pharmacy program. So I would strongly encourage you to identify a provider partner that's going to be trusted by your employees. I know one question that we have gotten from employees is like, is my HR director, is my fellow employee going to be the one vaccinating me? And the answer is obviously no, that you have to be a provider of record. You have to have a relationship with the state of Minnesota, be trained by the state of Minnesota to be able to provide COVID-19 vaccines. And so that would be another step to make sure to take, that your provider partner is registered with the state. It's not an onerous process. Many, many providers all across the state are registered with the state of Minnesota. But I think, again, it's kind of an example of both, identify the provider that's going to be most trusted by your employees, but also, as much as you can, create that safe space for your employees to ask questions is going to be really important, because being able to have those questions answered up front is going to help increase the amount of uptake that you get within your workforce, and that we know is going to be really important to continue to create a safe place for your employees to work moving forward.
For sure, and then I would again encourage the members on the event here that the COVID-19 vaccine resources page that we just launched on Monday has a lot of information and a lot of resources that you can use to talk to your employees, to educate your employees, or answer any questions. So please check that out. It's a living website that will continue to be updated with information that we get from other sources, including the Minnesota Department of Health. So that please check that out when you're able. So Joanna, that's all the questions I have. That's all the questions we received. So really a big thank you to you. You've been very responsive through this process, and we appreciate you taking the time to come in and share your insight and information to our attendees. And to everyone who's on the call, thank you for all your questions. These were great questions. I definitely learned quite a bit here, and it was good to sort of test Joanna's knowledge here, and she always is able to step up and answer. So thank you, Joanna, very much.
Thank you. It's a pleasure to be with all of you.
Great. So just as a reminder to everybody, this event will be available on our website later today. It'll also be available on our COVID-19 vaccine resources page soon as well. So with that, again, thank you, Joanna. Good to see you. And thank you everyone for attending and have a great day.